as baby comes in, then this top hand's just going to kind of come and put a little bit of counter pressure down towards the baby. You don't have to normally reduce the labia on a normal person. It usually stretches. As that hip comes, you're going to kind of push it down a little bit because you don't want her to tear up. So you push down until you see that top shoulder. As that shoulder comes, kind of you can slide one hand, still going down until that shoulder comes out. And then you're going to go straight up. Sliding a hand down together, baby, because they're super slippery and wet. And you can go right straight down to the bed or gurney or whatever you've got there.
Usually once the head comes out, the baby will do a natural rotation one way or the other. You just kind of go with whatever way they're going
for it. And you'll see the little head kind of turning, so they'll turn either way. But you're pulling down until the top shoulder, the shoulder goes underneath the pubis. And then if you keep going down, this bottom shoulder is going to tear all the way down into her bottom. So that's why you kind of do the natural down till you see the first, and then you can go straight up and down. Up and out. You can, if mom will stop pushing, it depends. Most of the time they're pushing. If you can, yes. And you'll do mouth first, and then you can do the nose. If you do the nose first, they do, and then they suck everything right back in. But if you can, if not,
can't you just tell them when the head is presented to stop pushing for a moment? And
if they will, If they will, then yes, absolutely. Do the mouth, do the nose, and then have her continue to push to release the rest of the body. Most of the time they will listen, but there's some that
dry the baby off, have no baby, just the best thing clamp and bring the baby up.
I thought we were supposed to wait until the umbilical cord stopped pulsating before we clamp.
I mean, you could, but you're probably going to be stimulating.
By the time you do the stimulating and the bulb suctioning, that gives you about 30 seconds or so, and that's usually what we wait, about 45 seconds for the cord to stop, and then you'll leave at least a couple of inches from the baby's belly up, just in case the baby has to go to NICU or do anything. They like to have a little bit of some room to access lines. You can clamp, and then wait for the rest of the placenta. The biggest thing is just a dry baby. A lot of times when we get these babies come in, they're very hypothermic because they've, got a wet baby and put up on mom, very wet. So drying is the best thing for these little guys.
That's their hats, so you can lay them on their mom's tummy.
Do most of you guys carry the hat?
Baby dry hat.
Oh yeah, that's one in our sort of little hat. Oh, perfect.
Did you find the backboard is useful because it's kind of got built-in stirrups kind of for the heels or something?
I don't know. She arrived on there.
Oh, okay.
She's probably got this is
our very compliant mother delivering on the backboard. Oh heavens no! I think this would be like trauma, whatever. Got her out of the car or something, but she would be very happy. So who wants to try? Just be careful. Your legs inch. So try not to grab it. Getting pinched. Oh, by the way, okay, by right here. So then my face is right down the middle. So if you can feel at the bottom, you're going to want to put on whatever that like over here. And there's going to probably be a natural thing that's kind of pushing in there to guide her. So one thing we're going to touch land out. But you got to do what you're going to see. It's going to be probably the gentle guidance for sure. Well, instead of hemorrhages.
Reevaluate.
And sometimes they'll do that. So once you see that first shoulder, then you're going to kind of guide up. You can kind of sandwich the head like same kind of alligator clamp the head there. But it's easy to feel like it right now. It's not straight up. Perfect.
So the first thing you really want to do is establish giving away. So
short cord.
See if you will get that. A lot of babies give 3 seconds. Stimulation.
So the first few
we've done that.
And then up to warm belly. So you know what it feels like. You can just pull their shirt right up and just get them right on their tummy. Oh, they can go right on the tummy with their head turned.
Easy. If mom's all sweaty or whatever, you still want to make sure they're dry. The wet and the head is no loss for them, and if they're wet, even if you put them up there and you're getting getting her ready to go, maybe change out the blankets to make sure they're dry. Because a cold blanket or a wet blanket can get cold really quick. And then they have more problems with the cold. Mom's body not so much surfishing up the baby as if they're not, you know,
10 cycles of that. Okay.
but if you keep them warm and dry and hat on them, and it's mom, cover them both.
And you can still be offering support while stressing, like doing the breathing while,
Probably want to help you breathe. You gotta start breathing.
And if they can't, in your situation, you probably, if they're coming that fast, you're probably
so anything greater than 100.
Most babies, when they come precipitous fast deliveries like that, you won't run into those complications. Most of the time they're coming.
Yeah, and the thing is, they're just really slick, and make sure you have somewhere to place the baby in their
Yeah.
No, but that's for self-cancer.
So, given that this is the end of the guide, it has to be at a rate of 8 to 10 to get this to inflate fast enough. You're going to adjust this pressure so that if I had a